biggest challenge that the country faces in the realm of healthcare in terms of its affordability and accessibility. Assam is no exception, and as a matter of fact, good healthcare is the need of the hour. This session will shed light on the several opportunities for investments in the healthcare sector in Assam, along with the delivery of quality healthcare in rural areas. The topic of the panel is the perspective of healthcare leaders, building future-ready healthcare ecosystem.
On this panel today we have Dr. B. Bhaskar Rao, Managing Director, KIMS Hospitals, Dr. V. Rakesh, President, Telangana Hospitals and Nursing Homes Association.
Can we have a round of applause for the speakers, please?
Shri K.T. Devanand, Regional CEO, Telangana and Andhra Pradesh Cluster, Aster DM Healthcare. Shri Abhijit Singh, Chief Operational Officer, Apollo Hospitals, GS Road, Guwahati. Shri Pravin Vardhan, CEO and Vice Chairman, Cure Tech Solution India Private Limited, Care for You Healthcare Solution Private Limited, Telangana and Odisha. Dr. Vinod Kumar C, Group Head, SCM Jahangir Hospitals, Pune. Dr. N. Dattasa, CMD, Downtown Hospitals, Guwahati. We request Shri N. Puthalingam Sir, MRICS, Vice President and Business Unit Head of Health, L&T Constructions, to join us on the stage and moderate the session.
Can we have a round of applause again, please, for all the distinguished speakers and panelists?
We have been listening from morning, evening, and everywhere, whenever we put our phone, that digitalization. Yes, we are in the true digital era. Children have taken the links, live links also, and there are many people watching it. And now people are more flexible after the lockdown. Recorded session dekhne ka aur acha lag raha hai un logon ka. So these sessions are also being recorded and then reposted. So let us give all our energies as live as we can and as enthusiastic as we are from the morning. So we wish whatever the good things come from you should be heard and be felt from heart of us also. Thank you so much.
Yeah, good evening to one and all present here. I think it's really a tough session at this point of time. Even though a lot of eminent panelists are available, the audience seems to be very less. You know, it seems that we have to strategically discuss outside the conference room. Let us discuss internally ourselves and how to take it forward. You know, that also one strategy we evolved during the discussion, especially on the lunch time. Basically, if you see this, panelists, most of the people are veterans in the particular area. I think to begin with, I think all of you know about. Morning we discussed about Dr. Krishan Rao. He's a MD and chairman of the KIMS Hospital. The hospital is available. He's having more than 12 hospitals. And Dr. Rakesh is also the chairman of IMA and again from Thana, especially on Telangana and Andhra Pradesh available. And Mr. Abhijit is available from Apollo Hospital. Mr. Pravin, we see the entrepreneur. I think morning we talked about entrepreneurship. Basically, started as an engineer and moved to the software and again into the entrepreneurship, basically into clinical side of this healthcare. And we also have Mr. Devanand and the veteran Devanand actually from Aster Healthcare. He talks about Medicity and the great senior most Dr. Mr. Datta. Basically, he's one of the founder chairman of this Downtown Hospital, Guwahati. See, basically, the healthcare system is concerned. Today, after the pandemic, globally, people realize the importance of the healthcare. So what we thought was, okay, slightly we discuss about how the system evolved, maybe in terms of the past. Today, what are the things presently what we are doing, and then we can go to the theme of future ready. Basically, what we are supposed to do in the future as a healthcare ecosystem. That's basically agenda. And if you see, I think most of you might have seen, basically, especially from Honorable Chief Minister of Assam, it is one of the objectives he made very clearly, enhancing both human and infrastructural capacity, increase accessibility, and targeting specific ailments. I think which will be morning many of us talked about, including medical tourism hub in the northeastern hub. And second, as a part of National Health Mission, they also mentioned about their mission, attainment of universal access to equitable, affordable, and quality healthcare services in the state of Assam. With this, keep in mind, And with the present system, with the future ready, what we are supposed to do in the future, on the healthcare system, we'll straight away go to the subject. And before going to this subject, and we also want to do the present system, I think there are a lot of ifs and buts, lot of challenges, and many of us know about how this health policy evolves. And today we are trying to address the non-communicable diseases. We also know lifestyle diseases. We are addressing lifestyle diseases. Now, there is a lot of study talk about in terms of your what you call in terms of cancer, which is especially in the northern eastern part. There are different study talks about different things. Again, what is the authenticity of the information statistics available? We all have the above. And second, in terms of this, if you see the India's population, predominantly most of the people are in this below poverty. Maybe more than 70% of the people are in the rural area. How we are going to address this one? And the life expectancy, I think some of you talked about wellness. I think most of the people talk about wellness in the morning. Also, Madam talked about wellness. Again, today also we have emphasis about the wellness. The life expectancy, it has been increased. As per the survey, from 69 to 70 in 2023. And most of the people are going towards proactively how we can able to maintain the wellness. That is one of the things evolving, not only in terms of diagnostics, in terms of wellness, how it evolves. And again, today challenge, I think many of the people, there are some mixed feelings for the people, especially the industry, healthcare spending. So, morning also Dr. Bhaskar talked about GDP. We are spending only around 2.5% GDP compared to the developed countries, which is more than 17%. In the US is spending about 17%, while in India we are spending only 2.5%. Are we geared up for that expenditure in terms of healthcare? We also having an aspiration to grow. At the same time, we're having the sufficient allocation of the budget. That is one side of the coin. You see, the other side of the coin, government has come with the Ayushman Bharat. Even then, covering the insurance for about 5 lakh per people. So, are we really utilizing this scheme? Really, whether everybody utilize this scheme? How many people are awareness? There's a recent study tells about even though scheme is available, the utilization of it's only some limited states they are utilizing the facility. Other states they are not utilizing. That is one of the challenges. And in addition to that, we also talked about, I think morning also some of the speakers talked about especially doctor to population, patient population, or in terms of your medical colleges, again number of beds to the population in comparison with the World Health Organization where we stand. We have a long way to go. Again, we are also have the aspiration of medical tourism hub, especially not only in the southern part, it is in even northeastern hub. So are we getting into the global NABH accreditation or JC accreditation? These are some of the things which is in the healthcare industry. With this background, let us begin this session with the first question to the Dr. Bhaskar Rao. See, basically, today we are talking about a lot of things in the healthcare. I think, Doctor, you can explain about what are the best practices, what we are following globally, and what we are doing, in India. And what are the things we can able to take it from the global and which we can able to implement in India?
See, there is a misconception of health. Everybody thinks if it is ill health, that is a health. It's not true. The health is defined as physically, emotionally and socially is fit enough, then only we will call as a health. So whenever a person comes, we need not look into only the disease and then treat. We need to cover these three aspects of it. How to cover that, that is the most important thing where we can able to look into the best practices. There are few important practices that we need. There is a clinical governance. The clinical governance says, one, whatever the person that comes to us, are we giving an effective treatment for them? Unless you don't give an effective treatment, there is no point treating just like that. Is it necessary to do? Can it be postponed? Can it be delayed? Just because somebody is having some disease, we need to be able to tell that is very, very unethical. For example, there are by birth we have small holes in the heart. What we call as a PFO, which is there before birth. Because of that hole, the body from mother to baby will come blood circulation. Some of them will be a pinhole, but there are people who can able to close that. This is not required. So that means the effectiveness of a treatment is, once you treat, whether he is going to be come out very well and live up to the physically, emotionally, socially, and we will able to cure that in that one. By doing that effectiveness, we need to be able to understand the disease pattern. It is not only treating the disease pattern, then we need to also do the audit by previous periodical checks. When patient is coming, am I giving a good treatment which is effective for lifelong? Second important thing, we need to do the research. When we keep doing the research, there is innovative methodologies, you will be able to get it. Once you get the innovative methodologies, then you will be able to make it very fine treatment. For example, if we talk about 50 years back, what is healthcare? Today is a sea change. That is all because of the put a questions on ours. If I can't do this, if I can do this way, how it can be able to helpful. There are many times when we were students, for any gastric problem, we used to do an operation called GJ, vagotomy. Today, that operation is totally disappeared. There are medicines has come. These are all because of innovative things. Similarly, we need to be able to learn from the feedbacks. Whatever is the patient gives, whatever is there, with these feedbacks, we need to be able to look into that. And we also keep checking the mortality, morbidity meetings we will be able to conduct. Once you start doing all those things, if some patient dies, that doesn't mean what you have done the entirely is the benefit. They will always say feedback, you go and postmortem, where went wrong, why we could not have done the other treatment, that will be able to help for the new patients. These are all the certain protocols and systems we create as far as the treatment is concerned. Similarly, there are many mishappenings that will be happening in even the developed countries also. One of the example is, the famous actress Sridevi was supposed to operate one side, they operated on the other side in America. So the thing is that protocols and systems what we created, smooth functioning of all the human beings, non-medical people, so that we can able to set right those things, those mishappenings may not happening. These are all the certain things which we are able to do it because of a less number of hospitals, less number of doctors when compared to per population. What is happening is we are overburdened. That's why some of the doctors will be keep seeing 100, 200 patients a day and also writing so many investigations. Whereas in the Western world, everything will be an appointment. If you come in that, you can spend a lot of time with the patient, understand the entire thing. It is not only that, after treating, again we also need to mention according to the definition of health, we also should be able to give a preventive measures. There are many things which you able to, some of the people have so many bad habits, like smoking, drinking, diabetes, all these things. It is not just giving a treatment itself. You also explain them, teach them, not only to the patient, it's also to the patient attenders, what precautions we should be able to take it so that you don't increase this disease and you don't even get into the complications of the disease which created, like any hypertension, diabetes, smoking will always create a lot of complications. These can be postponed if you are able to explain to the patient properly and also tell them these are all the practices that we need to do as a good human being or a doctor himself should be able to implement, then the patients will get the maximum benefit out of it. I think these are all the certain important things. There are many doctors who are practicing it. There are some of them are not able to practice. So with this, that's what I was telling about. If there is a proper clinical governance comes by appointment system, by there is a proper degrees that they have, everybody has their own way of treating the patients, a system, a protocol based. If there is a system like bypass surgery needs to be done, there is some protocols, some meds, like suppose if a liver transplant has to do, when to do, how to do, not that just having a disease, there is no need to do it. We can wait. There is those protocols we need to follow. These are all bidirectional. Some of the doctors will do, some of the patients will come and force the doctors, I want to get it done in next 6 hours. If you don't investigate properly, they always say that you are not investigated. And there are people who come back and say that I have a headache, please do me a CT scan. God only knows CT scan how he is going to identify the headache problem or cure the headache problem. Like that, there is a lot of awareness has to come from the public as well as to the patient to implement a good practices and allow the doctors to practice independently.
Thank you, doctor, for your feedback on that. I think over to Mr. Devanand. You also please explain on the best practices in the healthcare industry, especially the clinical portion of what we are doing within Assam.
Actually, not an expert in talking about Assam. I think we have experts sitting here. While I'll talk about the best practices that's prevalent in the industry, when you talk about healthcare, how many of you have gone to a hospital at in some point of time? Everybody would have gone to hospital. By birth, you will be born in some hospital, obviously. Then, other than that, how many of you have had bad experiences with hospitals? Yeah, I can see a lot of hands coming up. Yeah. So these experiences could be due to different things, like our Bhaskar Rao sir was saying. It could be due to the expertise of the clinician. It could be due to the process failure of the hospital. So when you look out for a hospital from the outside and evaluate it, you feel that a doctor is coming, treating, nurses giving some medications, but it actually is a very complex structure. Like Ms. Sunita was saying, it's a kind of teamwork that, it's a kind of symphony in action, because everything has to fall in place. Otherwise, anybody coming to a hospital is in pain. No one comes to a hospital just for pleasure. We always say that the only category who come to a hospital and gets out with happiness is only one category, which is that. Which category? A category of patients come to hospital, they go happily after discharge. Delivery, they go with a child. Otherwise, everyone comes with the pain, goes out with the pain because of the bill. So obviously, both sides is pain only. And to add to that, you have the turnaround time. Turnaround time basically is the waiting time that you have. Doctor comes in the morning, tells you discharge. 10 o'clock, the doctor would have told discharge, and you get discharged at 6 o'clock in the evening. She said, what the hell is happening, right? So these kind of things are there. So there are a lot of best practices that we all try as administrators, and we have very senior people sitting here. They all have been, struggling to make the process more simpler, more robust, more patient-friendly. So that is one. So few things on the turnaround time. Second is something which we all look up to, different good institutes which have put in good processes. We all learn from each other how they are doing it well. So we try to bring it. It can be an OP waiting time. It can be a discharge waiting time. It can be a pharmacy, medicine dispensing time. There are a lot of turnaround times in a hospital. Lab results. Second important thing is that, when a hospital you take treatment and then go out, usually there is no follow-up done from many hospitals. So there's a process, or there's a new thing which is coming called the care continuum. So even after the patient gets discharged, there is a follow-up happening to the patient to check how are you feeling, were you happy with the treatment, are you having any problems? So there is that new thing. It's called PRAME and PROME in patient-reported outcome measures and expectant measures also. So these kinds of things are evaluated. Then comes the biggest issue of affordability. Many people can't afford a hospital treatment. So we try to reduce the cost by bringing in more efficiency into practice. We try and understand the best practices at other hospitals, how they are trying to reduce the cost to a certain extent so that the burden of the bill can be brought down. So various means. On a broad level, when you look at it, in India as a country, we have a very good system of 3-tier healthcare system, which is working well in comparison to many other countries across the globe. We have a fantastic system. Because of that, at least healthcare is, at least at this point of time, affordable to the mass. But there is always this allocation issue. We always see that the allocation to healthcare, even though it's a very big, major sector, like general public, for us, how many of you go for a general annual checkup in a year? I can see only one hand going up. 2, yeah. So that's it. That's the least priority for us, our own health. When you buy a mobile, when you buy a car, when you buy, sari, you do so much of research, right? But when it comes to your own health, we feel we are healthy, no need of taking care of it, And that's what Bhaskar Rao sir also was trying to tell, you go to a hospital when you are ill. Let us come out of that myth. Let's go to a hospital when you are well. Let's try to, prevent things from happening so that, you don't have to spend more money. So that's something, the preventive wellness is something which we all have to focus. So that way, even if you look at it, the governments are not spending, sorry to make a sarcastic statement here, the spending that is allocated to health is very, very low in our country, which needs to be enhanced. Then comes the issue of universal healthcare, which we are talking about, where, Ayushman Bharat and all those things have come. How many of you, I don't know whether have gone through the Ayush, possibly, other than the people who are in the industry will look at the Ayushman Bharat rates and all. So many of the rates, these are all driven from some, existing central schemes. And when you really want to give a quality care at those rates in the hospitals, it's very difficult to match the cost, existing inflation and the other things. It's very difficult. So government, instead of starting more hospitals, adding more number of beds, it should actually support the private sector also by investing more on such schemes, so the private also will get benefited out of it. So on the broad level, these are the things on the public level, the government level, they should look at. At the hospital level, I mentioned like the turnaround time, the affordability, the accessibility, and then technology. We at Aster, we have a good hospital, that's what moderator was saying, which is at Kochi, Kerala, Aster MedCity. So we also try to bring in a lot of technological innovations, like the robotic surgeries. We have probably the first robotic pharmacy in India, where the robots dispense your medicines. So a lot of technology is coming in. But I find it very surprising to note that in India, very low amount of focus is given on devising or strategizing focus on medical devices. We don't invent any device here. So I think we are sitting in IIT. So I was discussing with Iyer sir also that I think they have already taken a step and they are already doing a lot of good work. So I think a lot more such research, innovation, technology, adoption should come in. So these are some of the best practices that others have done. So we should also emulate that. Thank you.
I think you talked about the hospital, especially in terms of how government can help on the private sector, and basically you also talked about expensive, especially on that. So before getting into these, now you also talked about some of the challenges, especially. So before getting into the accessibility and affordability, maybe my question to Dr. Ratta sir. See, basically today, even though we are developing this healthcare infrastructure, what do you find the challenges and the opportunities as a healthcare system at present?
Most of you, I am also a medical doctor. But in IIT, you get all PhDs. They do research and for the benefit of the medicine also. When I studied in 60, besides X-ray, ultrasound was not there. CT was, of course, not there. And in the ICU also, ventilator was not there. And then so many good monitors were not there. So I remember on my teacher, you must be remembered, Dr. Jogesh Mahanto. He was the principal of our college and he was a very good surgeon. He said that if you want to become a surgeon, you must have eagle's eyes, then lion's heart, and lady's finger. I don't know why he said lady's finger. Nowadays, I should not say so many crimes are being committed by ladies, but fingers must be very soft. So after that, slowly, L&T, so many new messages came. Now, at that time, the most common operation was exploratory laparotomy. You open the abdomen and find out what is there. And Sir used to say that abdomen is a magic box. You are thinking there is a stone, but there may be a tumor. So nowadays, it is so good. Ultrasound is there, CT is there, MRI is there, endoscope. You pass the endoscope through the stomach up to jejunum, and colonoscope is there. You can make a diagnosis beforehand. So now facilities have definitely facilitated a lot of patients to get benefit. But only problem, cost has gone up. I am in a private medical institution, so cost has gone up because after laparotomy, patient can be sent back next day after removal of a stone from the gallbladder. Previously 7 days they were there. So cost becomes, because laparoscopic Karlstorz is the most important thing, not LNT. So better sets are coming up, and all surgeons they said, please get this set because this is better. Even stone from ureter can be removed by laparoscopics. Even now, even heart surgery is being done by endoscopic surgery. And previously heart operation was about 6 inches or so, but now 2 inches. And brain surgery has become very easy. When I was there in AIMS, my teacher, Dr. Abron, I don't know, he died recently. He was my teacher. He was a very heroic surgeon. There is a tumor in brain, pituitary. Pituitary is a brandmaster of human endocrine system. So he said that let us try the pituitary through the nose. And he was very successful. He went through the nose because the pituitary sits above the nasal, sinus. So he removed it, and it was a heroic thing. But after that, we said, sir, please do again. Well, no, I am not doing. It is so risky. Patient may have some problem. Nowadays, neurosurgeon can do. Again, this is the root, nose and side. So things have improved so much, but cost has definitely gone up. And patients' expectations are also much more. Nowadays, when a patient comes, if you say that you need this operation, patient will ask, why should I need this operation? Because they have already read the disease in the Googles or in the book also. Some intelligent patient, they study the book also. They come, no, I don't want to go for this operation, you please give us separate suggestion. Then again, some complications are there, and complications, once complications are there, the codes are there, compensation you read in the newspaper. So one thing is very good, NABH, National Accreditation Board of Hospital. We have got accreditation for 10 years, and we have completed this time 264 items. And they say, NABH says that before you take the patient to the operation theater or any other community, you explain to him in details about the disease and also consequences of the operation or other treatment you are doing. And that has helped us in a big way. I was in France learning for ear surgery. They are not in England. England it was not there, but France has found it that what operation they are doing, they are showing it to the students and also to the attendants. So attendants, the advantage is, suppose ear surgery is very small, ossicles are there. They said that I thought this ossicle was damaged, but I find the other 2 ossicles are also damaged. So what should I do? If I remove all the ossicles, hearing will not come up. Then the attendants, they say, sir, please do, or please do not do. Then there has been so many cases where hysterectomy had to be done after pregnancy because excessive bleeding is there and doctor has been prosecuted. So this is a very good system. You have a CCTV in the OT and also CCTV in the attendance room. Then you can explain to them that this is the thing. There is serious bleeding. You cannot stop sometimes. Doctors are not God. Sometimes so much bleeding is there after the operation, then you cannot stop and patient may die. Very rarely nowadays. Lots of blood can be given. So I think things have improved, but in private hospital, they ask why so much costly? Because the machines now, MRI, what MRI was there previously, now new MRI is coming up. CT scan also has come up. And so cost has gone up. And in private, the government does not support us with machine and thing. And I am waiting. That day I met one young scientist, one girl. She is known to me. Then I asked her, what are you doing? She got 1 crore from Moody's, that startup. She said, I am doing brain mapping. What is that brain mapping? Well, I shall know the psychological condition of the patient. That's a great thing. I was very happy because patients die. So many suicide cases are there. Psychiatric patients are there. If in the MRI I have heard, you will know better, that you can study the condition of the brain, what the patient is thinking. Because mental health is a big problem. I think I am waiting for that brain mapping and an MRI which can give diagnosis, and that will save a lot of young people. Yesterday, one young person, he was standing in the rail station. It was in the newspaper. He rang up his wife, I am fine, don't worry. After that, he jumped in front of the train. So I think better days are coming for doctors also, because suits are there, many cases are there against the doctors. Then doctors can defend themselves. Thank you.
Yeah, I think you also talked about today's how this human mentality works. Basically, most of the people are not having, especially restless when you come to these hospitals, especially in a private hospital. When they come, they don't have patients. They want everything to be done immediately. They might take an online appointment. They can't able to wait. They put a lot of pressure. There are a lot of challenges you also told about. I think there's an opportunity also. The technology has given both challenges and opportunities. I think to add upon what everybody said, today we are getting into latest technologies, maybe robotic laboratory, or in terms of robotic surgicals. And in the morning also we talked about, some of the speakers talked about robotics. Is going to be a lot of technology comes in the healthcare system. So I think being a skill development session, I think we all have to, that's a whole industry has to upskill and reskill, especially on this system, basically on this technology part, which I want to emphasize here. Maybe we have to see that even including capability building as a whole for the industry. And second, I think most of us, we also having concern, especially on this, in terms of accessibility and affordability. It's not like that all our populations are, upper and middle class or rich people. Today, when we are having a mixed population, I think, what is your opinion, how we can able to make the healthcare system accessible to every individual people of this corner of this, Indian citizen, or how it be able to make it affordable? Maybe you can able to elaborate. In addition to that, you also can what suggestion we have to give to the policy makers, because in the end of the day, we also have to give some of the thought process to the policy makers so that they can able to do that one. Over to you, Dr. Mr. Rakesh.
Thank you, sir. Good afternoon, everyone. People on the stage and off the stage. I would like to take you into a different perspective. The health per se in India has two parts to it. One elaborated by the government side, one by the private side. So government side usually gives up to 20 to 30% of the healthcare is given by the government system, while rest 70% is given by the private healthcare sector. Again, in this, we have got primary care, secondary care, and tertiary care. So 10% of the corporates which we see here give this care, which is high-end care that is available in the cross-section of the society. But majority of us are dependent on these small, intermediate, and mid-segment sized hospitals. So from Telangana, I represent both the association, the Small Hospitals Association, that is TANA, and the mid-segment hospitals, that is Network Hospitals, that is TANHA. So from that perspective, when I look at it, what is the primary difference between both this government and the private sector? So government sector, it is available, it is in close proximity to the people, cost effective, but it is underfunded, understaffed, and not rising up to expectations. Private, once we come into the private sector, all these are different, but the only problem is the cost. So this is one of the primary objections that across the society we find raised by everyone. Now, why this cost is increasing in this corporate sector? There is a realistic analysis is done by many of us across the cross section of us, and we decide on the rate. Now, you want this particular rate to be reduced to make it affordable. To a point, a concession can be made. But if it is enforced, you are compromising on the quality care. So are we interested in a quality care? Are we interested in a quantity care? What is that we want? So once it's quality care, the government has to decide on two things. One, whether it wants a quality health care at an affordable cost, and to differentiate between both a BPL population, one strata where it improves its health infrastructure by the conventional means, as sir was saying. Open laparotomy was the procedure of choice. Then came the specific surgeries that went on. So what we need to do now in this present scenario is, how do we reduce the cost for the hospital? The cost of an hospital is not just dependent on the robotics or the recent advancements. Right from the inception of the hospital till its regular day-to-day costs to its, the monthly budgetary that has to be allocated. All these determine the cost of a particular procedure or something. For example, I'll give you an example. A cesarean section or an appendix, surgery laparoscopically done, the average cost for a mid-segment or high-segment hospital is between 75,000 to a lakh rupees. So depending upon the strata of that hospital, a particular patient. Now what happens is, the government wants us to do this, price capping is done, it has to be done at 25,000. Now what is it that determines my workflow is the number of cases I do with the frequency of the money that is released. So I have a prime example for us as far as this affordability is concerned is Ayushman Bharat. Most of you may not know, this Ayushman Bharat is a brainchild of a project called as Arogyashri that was implemented in Andhra and Telangana. Bhaskar Rao Garu was one of the key pioneers in trying to implement that particular scheme in our system. But unfortunately, as the duration of payment, the priorities of the government in question are going to come, it is going to cause a lot of disturbance, financial disturbance to the organizing hospital. So private healthcare in toto is getting disturbed by these mechanisms which are not thought of. Now next, in case electricity charges, for example, I just put across to you, most of us run electricity at a domestic rate of 4 rupees per unit. Imagine an hospital pays at 20 rupees per unit a commercial rate. So where does this cash has to be diversified? Obviously it has to be diversified on the patients. So there are certain examples, put you in short. What has happened is, without having a uniform outlook on healthcare, it is like having an international standardization, national ambitions, state priorities, and village rates. This is, in short, the healthcare has changed now too. So it has jeopardized the government infrastructure, it has jeopardized the private infrastructure. And at the end, neither the end user, that's the customer, that's the patient, nor the service provider, that's the hospital, nor the administration of the hospital, nor the government, neither of us are happy with it. So what changes needs to happen in this particular scenario are something where we make a comprehensive outlook as to whether we want to go ahead with what type of structure of policy. Now we have private insurances. Now looking at these government insurances, they are also getting spoiled, and it's going to be a new headache for all healthcare service providers in us. So in short, I would like to get to the notice of the moderator here that a policy decision shift needs to be made and a priority has to be set right for us to give a better healthcare across the PAN section. We have BPL population. Why only BPL population have to be given a better healthcare? Why not a person who is paying? It's after all you and I who are paying the capital investment in the form of taxes. Why shouldn't we get a proper health care? Why shouldn't we get a health card with which we can go into an hospital and take a quality health care. So why are we not addressing this? So once we address this primary question, then probably the healthcare will change. It's not just for BPL, it's for quality universal healthcare for all. Everyone should have in their strata of domain. Maybe you are in a 10K zone, you are in a 1 lakh zone, you are in a 2 lakh zone, your IT shows. Depending upon that, you will be given a card, a white card, yellow card, pink card, green card, XYZ card. So you go to a hospital, it is determined that you can get these structures. So for those structures, I will do a policy making of my cost constraints. So cost analysis for my hospital, I can do it better because I only know how much cost I have invested in it, what is my running capital, what is my XYZ in that capital intensive system. So whatever are the charges that I put forth have to be deliberated. That's as simple as that. Once we can get across to a policy like this, probably every structure, however costly it may be, however less costly it might be, we would be able to give a universal health care for all. That's in short I would like to say. Thank you.
Thank you, Dr. Rakesh. I think more you emphasize on the CapEx and OpEx part. Basically how it affects your, especially in terms of your cost of quality health care. We noted your point. At the same time, you also suggested about in terms of how we can able to create a solution in terms of concessions or other things which you can able to take as a ministry level, they can able to take it as a policy. Maybe as this point is very, very important today, being in a, in a country like us is very, very important, accessibility and affordability. Maybe I'll take little more time and to have add 2 more speakers, especially Mr. Abhijit Singh, who is representing from Apollo, and Dr. Bhaskar Rao also, because this is very, very important, which the message has to go to the concerned people to initiate the appropriate actions. I think with everybody's permission, I'm taking to 2 more speakers. I think Mr. Abhijit Singh.
Thank you, Chair. I think if you look at healthcare at large in India, I mean, there are 2 paradigms here. One is health, is the moment from health to wellness. So healthcare today is not just what happens in the hospital, in the 4 walls of the hospital. It is before it, during the hospitalization and much after it. So we could move a lot of the care, outside the hospital setting, which in turn addresses the challenge of cost as well. The other paradigm is obviously the coupling of Heal by India with Heal in India. So we're trying to, create as many doctors, as many nurses, as many paramedical staff to support the infrastructure here. The title of this conference is Rising Northeast. I think it should be Shining Northeast, because Northeast clearly is shining today. And, if you look at Assam, for example, I mean, we have 11 medical colleges for a population of about 3 crores. And the government is talking of 8 more colleges. So I think there is great thrust on infrastructure development of healthcare, which is going to address the cost challenge to a very large extent, in my opinion. Because, as many more hospitals, we have that advantage. We already have an advantage of price. The Indian quality is unmatched as far as healthcare is concerned. I mean, the number of JCI, NABH accredited hospitals speaks volumes for the quality of care which we deliver. And, with these 2 addressed, we could look at the price challenge being addressed. And obviously, we at Apollo in the Northeast have been working with some of the governments very closely, especially on telehealth initiatives. And just to give you, sir, a perspective on how we've been able to do it, with the government of Meghalaya, we run 5 digital dispensaries. And when we say that these digital dispensaries are not just teleconsults, we've taken it 1 level up, wherein we are able to do at least 25 lab tests, dispense about 83 essential medications, and do specialist and super specialist consults. And we've, so far in the few months since this project has started, we've been able to do about 7,000 consults, dispensed about 3,000 plus medication prescriptions. We've done about 4,600 lab tests, about 2,000 general consults, about 5,000 specialist consults, and we've also been able to do a lot of camps on non-communicable diseases. A similar project we've implemented in Tripura, where we run 1 tele-emergency, 1 digital dispensaries and 6 mobile medical units. So, and these projects have, touched about 5,000 lives as well. So, we've been able to really take healthcare beyond the metro locations to, and what this has done, because these people would have had to travel to, either the state capitals, or which in case of Meghalaya would be Shillong, and then if they require a higher treatment, they would have, come down to Guwahati or gone down to any of the other metro locations. But then what this has done is that only the, the people requiring the urgent medical attention are now coming to hospitals. So we are looking at, as a group, we are looking at healthcare not just in hospitals, but we are looking at healthcare more holistically. With that, obviously, is an objective to keep costs in control and to reach out to a wider population.
So, quality healthcare, how to improvise the quality healthcare in this country? If anything which we are talking about, any issue that comes, we need to go to the root cause. Why it is happening? How many of you feel that healthcare is very expensive? I'm sure all of them will raise. But it is, in my view, it's absolutely no cost. It's only lack of knowledge how it is happening. See, first of all, how these diseases, how much we spend to get a disease? Disease is freely you are getting, or you spend some money? Minimum 20 lakhs if you spend, then only you get a disease. Minimum 20 lakhs. To get a disease, you have to spend minimum 20 lakhs. Otherwise, you won't get diseases. As I said, health is a physically, emotionally, socially. How you are getting diseases? Physically, we are totally zero. If you talk about our parents, they are physically fit. Till 70 years or 80 years, I don't think they would have been visited a doctor. Why? They have good air, no pollution, physical exercise is good, fresh food. Whereas today, I went to the school at the age of 6. My grandchild is going to the school at the 15th month. Okay? We have plenty of playground in the school. But today, the schools are on compound walls. Everybody is focusing on air condition. Not only air condition, everybody wants to 99% marks. 9. So, if entire population gets 99.9%, where will all they go? So that's why morning, evening, extra classes, so many things, that's why the physical is gone. Emotionally, everybody wants to become greedy. They want to make it so blood pressure is getting tension, earning money, time spent on the road. Socially, if somebody is going on bench car, I need to go to a bench car. So you are comparing, your expectations are increasing. That's how you spend a lot of money to get diseases, okay? Whether in the form of smoking, the amount of money you invest on smoking to get a disease, the amount of alcohol the amount of money you invest in alcohol, with all the junk food or lack of exercise. Even if you sit in the house, even to close your door, you have a remote. You have to close your switch on or switch off the TVs also, you have a remote. So where is the physical exercise? Even to, from house, get into the car, AC car, and go to the hospital or go to the office, take the lift, and you go to the AC room and come back. Where is the exercise? These are all how you are able to buy the diseases. So when we buy a disease by spending 20 lakhs, if the person wants to spend for 2 lakhs or 3 lakhs in the hospital, they feel very frustrated. So even if you are able to put it in a proper manner, health is also making money. Health, disease is also making money. Going to the hospital is also making money. You understood this? How many of you have insurance? Only 1, 2, 3, 4. Okay? You buy a house, you do insurance. You buy a car, you do insurance. You buy a scooter, you do insurance. You also do insurance for your suitcases when you travel overseas. But you don't do the insurance for your own health. Without health, you can't earn money. Health is wealth. So you people don't even do health insurance. You know what is the cost of health insurance? It's affordable for every person. You know the cost of health insurance? It's a cup of coffee. It's a cup of coffee. The health insurance is a cup of coffee. I'll tell you how. Every cup of coffee will comes around 20 rupees. Okay, minimum put it 20 rupees. You take 2 cups of coffee every day, 40 rupees. So 365 days, how much it comes? Nearly 1500 rupees. 15,000 rupees. Yeah. 15,000. A family of 4 people, 3 people, 45,000 rupees. If you pay 45,000 rupees for the insurance, you get not less than 10 lakhs worth for the entire family. Okay? Sorry? Okay, even 20 lakhs if you get it, you can write royal to go any hospital. The cost of a hospital expenditure varies from 1 lakh to 1 crore. Quality will come with a cost. We are all being habituated over a period of time. Health should be borne by the government at free of cost. That is the only mindset that all of us has. So if you people are able to do a mixture of the government comes with a policy where at least a minimum of 50,000 or 1 lakh universally you do insurance for everybody. It doesn't cost much. Then over and above, if anybody wants, they can able to pay from their own pocket so that they can spend for 50 lakhs, 60 lakhs, 70 lakhs. Buying health care is cheaper than providing health care. Government should be able to understand the Ayushman Bharat, what they are spending, is not even the budget of the entire Assam, for the entire country of 50 lakh population. So that is buying. The purchasing of health care from a health care provider is less expensive than providing the day when you are talking about the health care budget in the state, how much they are spending, but the amount of treatment that they are getting by the public institutions, if compared to versus all the state government schemes like either Ayushman Bharat, Arogyasri, that's where the Arogyasri scheme has been created. I am the chief architect of that and implemented, but today it has been misused by many people. That is the one scheme which brought the government into power back. That's the reason they have been misusing every disease they are adding into the Ayushman Bharat or Arogyasri. So if we are able to really look into that, health is not an expensive thing. We don't understand that. We have to make a preventive and as well as the, I don't say that you should not have all these habits, but you should be limited these habits. Everybody has to enjoy the life. Everybody has to be happy, but in a limited sense it will be able to help. If it is more than that, it will be able to destroy your health. When you are destroying and then you either come back on the hospitals or come back on the government, nobody is able to help, we are there. Today, it's a fact, the people who admit in the hospitals, by the time they get discharged, the people who are above poverty line, by the time they get discharged, they all fall, 40% of the patients fall below poverty line. It's very expensive, there is no doubt in it. Health quality will come at a cost. Your life is more important than your money. The whole life, what you earn, for whose sake? You need quality. Quality comes at a cost. 50 years back, there is only one doctor for the entire body. There is only one X-ray was available very rarely. Today in radiology, it has gone up to an X-ray to an MRI which is costing around 15 crores. How do you able to provide the same cost for everybody? So you need to be able to evolve the mechanisms, how we are evolving to earn more and more money. Like that you evaluate your own thing. If any one of you know the budget, it is even, forget about the cup of coffee, it is even if you 5% of your income in a yearly you spend on your health, which you are working for it, it will become easy. You save a lot of money. You don't need to below poverty line. There are many people who do insurance for 4 years. They don't get a disease. They will stop. I didn't get a disease. They will get tension in that. With that, they will get by BP. Because I have unnecessarily wasted my money. He stopped it. Next year, you will get a disease. So, insurance company will not pay. See, you are buying a car for 10 years. Whether it makes an accident or not, you keep paying. Similarly, we need to be able to take care of our health by paying insurance. You need not dependent on anyone. If there is no health, your entire family on the roads. A person who is money earner, if he is sick, the entire family go into roads. So we need to take precautions. First, we need to be able to concentrate. You become a busy. We are all busy. Till 70 years, I haven't got any disease. We keep doing all physical exercise, good food, little bad habits. Without bad habits, you can't able to sustain. The GDP will go down. Sorry? Yeah, homemade also now what happened? If you cook once, you eat for 10 days. The microwaves, so much of cancer it will produce. Whereas in olden age, in villages, every day they have morning fresh, evening fresh. So healthcare is very easy, provided if you people are able to understand, spend little money on insurance, you don't need to worry. And this insurance also you can basically keep on increasing depending upon your age. You start with 1 lakh, you can go up to 2 lakhs, 5 lakhs, 10 lakhs, 50 lakhs, 1 crore. That is one way. Second thing is, we are the one who are going to, we don't need to demand the government. Government cannot provide everything free. We need to spend ourselves. We need to take care of ourselves. We need to take care of our health. Everybody can afford the health care, provided if they do. If they can able to do, then we can also bring down the cost. The cost will come down by volume, not by improperly use the quality. Quality has to be there, infrastructure has to be there, then we need to be able to see all these things. This is the way which can able to help the patient, the public, and as well as the government to come back. Today, 140 crore population, if everybody spends 1,000 crores, 1,000 rupees per year, 1,40,000 crores on our own if we spend, every one of us will get a good health. We are not spending even 40,000 crores today. It is a burden on the government, but every one of you should be able to spend 1,000 rupees in a year. 140 crores will become 1,40,000 crores. With this, at least 25 crore population will get jobs. 25 crore population will get jobs out of it. 1,000 rupees if you spend, for the sake of 1,000 rupees, government itself is giving for every family 1 lakh rupees every year. Both the state governments and central governments putting into their accounts. But still they are all coming and saying hospitals are looting, corporates are this, that is that, these, all those. So we need to be able to understand. We need to be able to propagate this awareness amongst the public. Then only we can able to do. Thank you. I think.
In fact, we got a wonderful feedback from both the panelists, especially in terms of, there are two takeaway. One is how the common man able to cover under the insurance, who can take up the insurance proactively. At the same time, if you see other way around, the government can make a policy wherein the insurance should be mandatory for everybody. It is a whole country. If you can able to make insurance mandatory, it can cover all the people. I think this can be a takeaway which you can able to put to the concerned people from this summit. I think again we coming to this northeastern. We are in northeast. Morning also we talked about many of the states many of these countries are adjoining the northeastern port. I think today we talked about three, or even minister also, honorable minister also told about 3 or 4 countries sharing these borders, and how to bring investment to the northeast. Even there are some, government are relaxed some of the norms in terms of FDA to the extent of 100%, especially for the healthcare, predominantly for the greenfield.
and 74%, if I remember correctly, for this brownfield. And in addition to that, what are the ways and means how we can able to attract investment in Northeast? I think I'll ask Mr. Dr. Datta to respond.
Though it late, but I think we have had a very fruitful discussion, and doctors are always blamed most of the time, but some patients always praise you. That is the only pleasure a doctor gets. So thank you very much for staying back so late. Thank you.
I think basically I'll give it to Mr. Praveen also. So he also talked about how we developed this, especially on this, basically on the clinical side. And we also talked about something on the Make in India, or maybe medical devices park or pharma park. Maybe what are the things we can able to bring in northeastern part of India?
Good evening, everyone. One advantage with me is I am the son of the soil. Though I am settled in Hyderabad, I actually did my 10th from Assam and then shifted to some of the other places abroad and all. Being the last speaker, I just wanted to ask you, how is the Josh? Is still there? Lot of subjects already covered, right? Before I come back to engineering, two things that I wanted to really add on to whatever has been said. I think the word affordable and accessible are very overused, honestly, because I'll give you 2-3 examples. I have been traveling across various parts of Assam before I started investing. People are talking about investing. I've already started investing, setting up super specialty clinics across Assam. Now, what I have seen is, in Karimganj, I have a house. And one day, I just went to the market. Generally, I don't go. I went to the fish market, right? So there were some fish which came, right? And it was costing around 4,000 or 4,500 per kg. You won't believe there are around 40-50 kgs. Within 30 minutes, it's gone, right? It's completely gone. So people are spending one day fish 4,500 plus. Everybody is taking more than a kg or whatever, right? For a fish, right? Unfortunately, the same priority is not there for healthcare, right? So that's one thing. Second thing is lack of awareness. I'll give you an example so that we understand it better. So there are some, the hierarchy of the doctors. So MBBS, MD, and then DM or DNB or MCH. Super specialist, right? So I only deal with super specialist, bring super specialist from across India. So I have got one more company called Care for You, where 8,000 plus doctors are empaneled. So I have fantastic relation with a lot of doctors. So I bring some of them, the best doctors, to various locations of Assam. Now one day, one doctor came from one of the top hospital in Hyderabad. And after seeing the patient, he only wrote one medicine. Next day, that guy came and he complained, "Apna doctor to bhalo noy, it's in Silchar. একটাই মেডিসিন লিখলো কি একদম বাজে ডক্টর আমাদের ডক্টর তো 5টা মেডিসিন লিখে so what he was saying is the doctor who has come from Hyderabad is very disappointing because he has written only one medicine. My local doctor always write 5 medicines. So that is what we call lack of awareness. It's ignorance completely about the healthcare, right? So you do not have priority, we do not have knowledge about healthcare, and we actually derive, what is good for us. It's not right. We need to understand that healthcare today, India is not known for preventive healthcare at all. We are always curative. So we have a problem, we just go to the doctor, right? Even with all these aspects, the cost of healthcare in India is 1/10 of what it is in US. Today you may not know that people from US are actually coming and getting treated in India, and that is because the cost is relatively lesser. So what I am trying to say is the opportunity is always there. The affordability also to a greater extent is there because there are all variations. you may not need to spend 1 crore in every hospital, right? So there are all variations for different classes, masses. So you can always choose. So that aspect I feel we need to understand. In terms of technology, I think there are two parts, software and hardware. There are equipment. Now I think, in Assam, there are 4,621 sub-centers, 1,024 community health centers, 251 community health centers, and 1,024 primary centers. Only 25 district hospitals and 15 sub-divisional hospitals. These are 2 years earlier data. With Mr. Hemant Biswa Sharma being the CM, he is accelerating the process of establishing hospitals. The number might have slightly gone up. You won't believe that, there was not a neurologist in entire Silchar with a population of 40 lakhs, right? There was not a gastroenterologist. And I was the first one to bring neurologist, gastroenterologist in Silchar, right? So there was a tremendous amount of response that I see, but bearing that fact, and in the technology front, I wanted to tell every nooks and corners, even the staff centers that we have, if you want to provide quality healthcare, there are two things that we can do. Remote consultation, adaptability. If I look at 10, 12 years back when I started my entrepreneurship journey in healthcare, there is no acceptance of remote consultation, telemedicine. Today, with pandemic, I think there are certain amount of acceptance from both the parties. Remember, there are multiple stakeholders involved here, primarily the consumer or the patients and the doctors. So from both the parties, I can see, there are acceptance. So we can probably, tie up all those sub-centers to primary health centers, to community centers, to secondary care and tertiary care. And I would believe, if we can actually distribute, Mr. Kalyan can take it forward, if we can actually, give region-specific thing to tertiary cares or multi-specialty hospital. For example, KIMS is given responsibility of entire Bharat Valley. They will figure out, they will make sure that there is an integration done, and then, the quality healthcare reaches to the deepest level of the villages that exist in the Kachar district, Bharat Valley area, right? So that has to be driven. See, at the end of the day, everybody has to make sure that the ROI is realized. If you invest, your return on invest into is to be ensured. That is business. I think hospitals are there for business. So their, vested interest also need to be taken care of. And the only way you can take care of is assurance of the fact that they will get business out there. So if you can exclusively give certain rights, they will figure out how to actually solve some of the problems and then take the quality healthcare deep dive into the rural area, where today we are talking about cost, and cost. Fortunately, if we take doctors to the village instead of villagers to the doctors, which is Hyderabad, Bangalore and all that, the cost does not only involve clinical aspect, it will also have accommodation, food, then traveling expenses, which actually add on to the cost, right? We can actually take the doctors to the villages. We can also, at least to the extent of Silchar, Hailakandi, Dibrugarh, Jorhat and all that, I can take hundreds of doctors from the 8,000 doctors that I have in my panel, right? So that could be a possibility, provided the doctors also see benefit by going there. And that benefit can be only ensured by, entertaining and providing all sort of support from the government to those doctors, to the hospitals, assigning certain areas to specific tertiary cares. So that is all is important. We do not have, IIT students left. Probably I also wanted to talk about the software technology part of it, how we can actually evolve. There are 3 startups by IIT Guwahati students, which are actually unicorn. Unfortunately, there are not a single startup which is a unicorn from Assam. What I want is, if we can collectively look forward and make at least one unicorn from Assam, that would be fantastic. And I can tell you, healthcare is a very good opportunity. It's a fantastic opportunity. Assam government, if he collaborates, he would be able to, help the, create the conducive environment for that startup. Because what happens is today, the EMR data is one of the essence where everybody's mind is there. Everybody wants to access the data. Nobody wants to maintain it. If we can, some way maintain and create the EMR data, from that billionaire can come. And that is what software will do. Thank you very much.
Thank you, Mr. Praveen. I think you also touched upon the basics, how we can able to give a quality healthcare in the rural system. And you also touched upon this, how we can able to motivate the doctors, especially medical practitioners, to work in the rural areas. I think I saw recently some of the governments, state governments, they also given special pay for the people who work in the rural areas, not only in the urban areas. There's a separate pay actually for that. I think that to the last question, what we know, even though you partially you addressed upon these rural areas, and Mr. Devanand also would like to answer for this, how we can able to do quality healthcare in the rural areas.
Summit which looks for investors to come to Assam. So just one point, because there are a lot of administrators who are policymakers sitting here. There is one model from Tripura government which in which the government has taken proactive steps to not only allot the land, it also have gone to the next step of creating a building for the hospital and calling up the private parties or the private healthcare players to come and invest in the equipments and operate the hospital. So that shows the proactiveness and the effort taken by the government to really attract investors. If you really ask any other private healthcare provider to come to Assam and invest directly without the government commitment or the government will to set up something like that, it is an experimental effort from other players also to come to an uncharted territory. So if government really comes forward, government of Assam, I'm sure they will be definitely looking at it. The possibilities of giving land and a building, probably different locations where they feel require quality healthcare, there will be definitely providers, healthcare providers, including my company Astra. Bhaskar Rao sir also is here. So we'll be willing to come and invest on the equipments as well as operate the hospital. So that I think should be the step forward to attract more investors, especially healthcare players, into not only Assam, the entire northeastern states. So that's all. We also run a hospital in a place called Wayanad, which is one of the most distressed district in the country, the north part of Kerala, which is very close to Ooty. So we have a lot of PPP models also in the hospital, where especially for the delivery of the tribal women, and a lot of initiatives on the cancer. So we had done a lot of initiatives like that. So some such PPP models also can be looked at, especially on as a project. You can call private healthcare players to come and specifically work on certain projects. That will be another opportunity. So I don't want to take much of time. Thank you for the listening. Thank you.
I think we covered almost all the 4 sessions. And anybody is having any questions, we'll take the questions and then we'll conclude sessions here.
Good evening. Actually, in Northeast, lot of CISF's funds are there generated by ONGC and then GAIL and all. I think you can look at that fund because every year that fund remains unused.
I think we can note down some of the people, we can take it further. Any other questions? I think thank you for the patience hearing. Thank you, wonderful panelists. Thank you very much for your contribution for the industry.
You have to give me a minute to thank you all. I understand the ages of doctors sitting here. So let me recollect 1 minute of what I remember from my childhood. My grandmother's doctor's name is Bhaskar Rao Garu. If we go there and meet him, all the illness is gone. That's the whole imagination we all of us had. From my parents' time, it's like when doctor just see your hand and give something, you're done, you're fit to go. No need of much medicines. But now, the funniest part is everybody is a Google doctor. Whenever we need something, Google doctor comes with Nyaya Gyan. And everybody comes with a new things. So as a child, I have got this in my head, a doctor has a great thing. I am a psychologist. So when I started my practice, my game has turned in a different way. Like the coin has 2 sides. You being the practice, how painful it is to run and give the quality to the people. The same challenges I am also been understanding to give the quality of time and therapies, whatever we go on. We are with you. I should totally say that this session, a panel of discussion, what we had, is a proper, pure, perfect, peaceful discussion we had. No hassle, no fussle, no run, a clean cut, because we have the decision makers here, we have the think pots here, we have the need here already, we have the solutions already there. All of us are at ease, at comfort for a purpose. Thank God we all are on the purpose. Thank God the reason why we all are sitting is survived. Thank you for your patience from the morning. Whatever has happened happens for good. So all good things will happen for the good for everybody. Thank you so much. Allow us to call Radhika Rastogi ma'am on the dais to do our respectful job of giving a memento from our side. We welcome Radhika ma'am, all the dais. Now, जो भी है, इतना ज़्यादा double सुनाई देगा, तालियां दबाना ही पड़ेगा इसे बहुत ज़ोर से.
Thank you so much to all the speakers for enlightening us with your views. Now, as a token of appreciation, we would like to felicitate our distinguished guest here on stage with a memento. Could we have a round of applause for Dr. B. Bhaskar Rao, Managing Director, KIMS Hospital. Here we have Dr. N.M. Datta, CMD, Downtown Hospital, Guwahati. Dr. V. Rakesh, President, Telangana Hospital and Nursing Homes Association. Can we have a round of applause for Dr. V. Rakesh, President, Telangana Hospital. We have Shri L. Puthalinga, Rex, the moderator for the event. Can we have a round of applause for the moderator? We have B. Bhaskar Rao, the Managing Director, KIMS Hospital. Can we have a round of applause for Shri Abhijit Singh, Chief Operation Officer, Apollo Hospital.
We have a group of the photographers.